Hello, this quality improvement proposal is on faculty-led versus student-led exam reviews by Allison Duarte, Joelle Hilton, and Darian Zelazny. Thank you. The Project PICO problem is in the nurse anesthesia students will post exam reviews with faculty-led versus student-led improve subsequent exam performances. With the P being students in FIU CRNA program, I is post-exam review, C is the faculty-led post-exam review versus student-led post-exam review, and O being improvement in subsequent test scores. The Bloom's Taxonomy Learning Objectives. With the Bloom's Taxonomy Learning Objectives, students will be allowed to find answers in their books during post-exam test review. Students will defend and support their answer choices either in a faculty-led or student-led post-exam review. And students will differentiate between answer choices where more than one answer is correct and examine why another answer choice is better than the other.
Comprehensive examinations remain one of the most widely used methods for assessing knowledge in higher education, particularly in graduate health professional programs such as doctoral nurse anesthesia. These exams serve both formative and summative purposes, helping educators evaluate knowledge retention as well as readiness for progression in these rigorous programs. Research suggests that a well-designed examination can actually enhance learning by improving memory recall, increasing motivation to study, and reinforcing knowledge retention. However, the benefit of examinations does not end with the test itself. Opportunities for self-assessment and meaningful feedback are critical for helping students understand mistakes and refine their study strategies. Post-examination review sessions allow students to analyze errors, clarify misunderstandings, and connect theoretical knowledge to clinical application. This process is particularly important in nurse anesthesia education, where students must retain large volumes of complex information and apply it accurately in high-stakes clinical environments. Improving knowledge retention and reducing errors ultimately contributes to safer patient care and better clinical outcomes. To better understand the best post-exam review strategies, a comprehensive literature search was conducted. Keywords included terms related to post-exam review, exam feedback, exam wrappers, and knowledge retention. After screening the results and applying our inclusion criteria, 12 studies were selected that evaluated exam feedback strategies in healthcare education. A common theme across the literature is that students frequently perceive traditional post-exam review methods as delayed or inadequate. On the other hand, scheduled and structured review sessions appear to improve engagement among students and perceived learning. Another strategy that was discussed in the literature is the use of exam wrappers, which encourage students to reflect on their study strategies and identify areas for improvement. While these tools can enhance metacognition, their impact on subsequent exam scores has shown mixed results. Students comparing student-led and faculty-led review sessions suggest that both formats can improve understanding and reduce anxiety, though measurable academic outcomes are often similar between the two approaches. Overall, while structured feedback strategies appear to be beneficial, there is limited quantitative research specifically examining post-exam review methods within nurse anesthesia education, highlighting a very important gap in the literature.
Now that we have provided you with some background information regarding our topic, let's discuss our solution. Our quality improvement project aims to determine which exam review method, faculty-led or student-led, will improve the subsequent exam scores of nurse anesthesia students. The student-led group will continue current processes where an exam wrapper will be filled out after every exam, answering reflective questions as in how much time was spent studying on the material, where they felt they went wrong, and other questions that will help guide the meeting with a faculty member to help pinpoint concepts that they can improve on, versus the faculty-led, where an exam wrapper will not be used, and the student will be able to see their exam with a faculty member, and they'll show them which questions exactly they got wrong, and discussion will be able to be had about those concepts. Students will be randomized into each group for a semester. All students who receive a grade below passing must schedule an exam review meeting as current process, whether they're in the faculty-led or student-led group. And students who score above passing have the option of scheduling their exam review if they want. Exam scores will then be compared and analyzed to assess improvements in exam scores with consideration of which exam review method was utilized. Opinions on each method will also be collected from both students and faculty. The key takeaways from this presentation include that the success of nurse anesthesia students are at the core of this quality improvement project. Improvement in exam scores will lead to increased success and decreased attrition of the students, therefore leading to increased success of the nurse anesthesia program. Intentional review of mistakes on tested content will increase the understanding surrounding anesthesia concepts, which will lead to safer clinical practice and stronger anesthesia providers. Identification of study strategy shortcomings will allow for an improvement in student study habits to allow them for greater success in the future. Thank you for taking the time to listen to our presentation. We hope that you have learned something and enjoyed it. Thank you.